Hello, nurses all over the world. It's your nurse again, Nurse Felicia. I want to welcome you back to my channel. If you have been engaging my video, I want to really appreciate you. And if you have not subscribed, kindly subscribe to my channel. So today we'll be talking about carpal tunnel syndrome. Drum rolls. If you have not heard about this particular topic or disease condition as a nursing student, this is a very good time for you to learn. And as a practicing nurse, if you want to refresh your memory, then this is the time to learn. And we are going to be learning together, okay? So let's go straight into the topic of today. Carpal tunnel syndrome is a common condition that causes numbness, tingling, and pain in the hand and forearm. And the condition occurs when one of the major nerves to the hand, that is the medial nerve, is squeezed or compressed as it travels through the wrist. So that's what happened. And in most patients, carpal tunnel syndrome gets worse over time, and if untreated for too long, it can lead to permanent dysfunction of the hand, including the loss of sensation and weakness of the hand. For this reason, it is important to diagnose carpal tunnel syndrome and treat promptly. That's it. How does this carpal tunnel syndrome happen? Carpal tunnel syndrome occurs when the tunnel becomes narrowed, or when the tissue surrounding the flexor tendon, that is also known as synovium, it swells. That is, there's a swelling there, putting pressure on the medial nerve that I mentioned before and reducing its blood supply. So when there is compression in the medial nerve, then it reduces the blood flow through it. Then this abnormal pressure on the nerve can now result to numbness, tingling, pain, and weakness in the hand. So let's talk about the causes of carpal tunnel syndrome. Most cases of carpal tunnel syndrome are caused by a combination of factors, and studies have shown that women and older people are more likely to develop this condition. Let's talk about other risk factors that are associated with carpal tunnel syndrome, and they include heredity. It is very important to know this, that there are individual differences. Some individuals are tall and some are short. So when there is anatomical difference, that limit the amount of space for the nerves. Some they can have enough space for the nerve, and some can have narrowing space for the nerve. Then it puts pressure. The nerves are not able to work effectively, and this can be a trait that runs in the family. So that's where heredity comes to play. And another one is repetitive use of the hand. Repeating the same hand and wrist motion or activities over a prolonged period of time may aggravate the tendons in the wrist, causing swelling that puts pressure on the nerve. So when there's repeated use of the wrist and the hand, always in motion, the kind of job that you do or the kind of job that the patient do can put that patient at risk of developing carpal tunnel syndrome. Another one is hand and wrist position. So doing the activities that involve extreme flexion and extension of the hand and wrist for a prolonged period of time can increase pressure on the medial nerve. Another one is pregnancy. Hormonal changes during pregnancy can cause swelling that results in pressure on the nerve. You know, pregnant women, the hormonal imbalance can cause swelling, and when there's accumulation of fluid or so to say swelling, it puts pressure on the nerve. And so that is how a pregnant woman can come down with carpal tunnel syndrome. Another one is other health condition. So other health condition like diabetes, rheumatoid arthritis, and thyroid gland imbalance. All these conditions are associated with carpal tunnel syndrome in the sense that they have to do with nerves. Especially, for example, diabetes. One of the complications of diabetes is neuropathy. So there's damage to the nerve, and this can actually cause carpal tunnel syndrome. Let's talk about the signs and symptoms of carpal tunnel syndrome. Numbness, tingling, burning sensation, and pain. Primarily in the thumb, in the index finger, in the middle finger, and the ring finger. So this is the only exception when it comes to the numbness, the tingling sensation, the burning sensation, and the pain in the finger. And this often wakes patients up at night. You know, patient comes to you and they complain that I can't sleep throughout the night. Another one is occasional shock, like sensation that radiates to the thumb, like occasional shock, and it radiates to the thumb, the index finger, the middle finger, and the ring finger. Pain and tingling that may travel up the forearm up to the shoulder. So there can be pain and tingling that can go up to the shoulder from the forearm. Weakness and clumsiness in the hand, and this may make it difficult to perform fine movements such as buttoning of your clothes or even combing of your hair, just that the hand feels weak. Another one is dropping things due to weakness, numbness, or loss of awareness of where the hand is in space. So there's issue with proprioception. So there's issue with it. So, and proprioception means lack awareness of where the hand is in space. So when there's no awareness, then the individual can drop things anyhow and things falls off the hand. In most cases, the symptoms of carpal tunnel syndromes begin gradually and without a specific injury. So it sometimes can be atraumatic. Many patients find that their symptoms come and go at first, yes, and however the condition worsens and symptoms may occur frequently or may persist for a longer period of time. And sometimes all these symptoms are common at night. They are common at night. They tell you, I feel weak, I feel this tingling sensation, I feel those pins and needles in my forearm, in my wrist, traveling up to the shoulder. So let's talk about diagnostic tests. And another name we can give to this diagnostic test is electro-diagnostic test for carpal tunnel syndrome. And the first one we'll be talking about is nerve conduction studies. Why are we carrying out all these diagnostic tests? It's just to know the severity of the condition, to know whether the nerve is compressed in other locations, is it localized or spreading, whether the other nerves are affected, you want to know, and whether there's an underlying medical condition like diabetes, arthritis, thyroid imbalance, and so on. Then talking about nerve conduction study, that is NCS. This test measures the signal traveling in the nerves of the hand and arm. So we want to know the signals traveling in the nerves of the hand and arm, and this test can also detect a nerve that is not conducting the signal effectively. So that is the work of NCS. Nerve conduction studies can help the doctor determine how severe the problem is, and this can also help the management of the condition. The second one is electromyogram, EMG. EMG measures the electrical activities in the muscle, and it can show whether the patient have any nerve or muscle damage. So we're just trying to, with the EMG, we're able to discover if there's any nerve or muscle damage. Another one is ultrasound. And ultrasound uses high frequency sound waves to help create pictures of bone and tissues. So how does ultrasound help us in discovering carpal tunnel syndrome? So it helps to evaluate the median nerves for signs of compression. So that's why we are using ultrasound, just to know if there's compression in the median nerve. And another one is X-ray. X-ray provides images of dense structures such as bones and other structures, and if there's limited wrist motion, there's a limited motion in the wrist, or there's pain, then this can help to exclude other symptoms like arthritis, ligament injury, or fracture. So X-ray is just to help us to rule out some other conditions like fracture, ligament injury, or arthritis. Another one is MRI, which is magnetic resonance imaging. This provides better images of body soft tissue because obviously X-ray cannot pick soft tissue injury. So other than X-ray, we prefer MRI when we want to look at the soft tissues, and this helps to look out for abnormal tissues that could be impacting the median nerve. So we want to know, is there any tumor there? Is there any tumor around the place? Was there injury before and there's now scarring? Because if there's a scar there, it can squeeze or compress the median nerve. For example, if there's no proper healing, or the injury was quite deep, the laceration was quite deep, and the scarring, probably it was not sutured, or the circumstance that may happen, and there's a lot of scarring there, then that can also affect the median nerve. So next one we are talking about is the treatment of carpal tunnel syndrome, and it's divided into two: the non-surgical treatment and the surgical treatment. The non-surgical treatment, the first one is the patient can be given brace or wrist splints just to keep the wrist in place so that there will not be too much motion, and it keeps the individual from bending the wrist while the patient is sleeping, just to avoid the compression on the median nerve. Another one is NSAIDs, non-steroidal anti-inflammatory medication. So, such as ibuprofen, naproxen, and what are they doing? What is this medication going to do for the patient? It's just to reduce inflammation and to relieve pain. Another one is steroidal injection. So, steroid injection like corticosteroids and cortisone, and they are also powerful anti-inflammatory agents that can be injected into the carpal tunnel, thereby bringing relief for the patient. It helps to calm the flaring up of the symptoms of the patient. But the most the unfortunate part of it is just a short-term treatment, because sometimes the patient can come down and say, oh, there's flaring again, I had pain, I was given steroid injection, I'm fine, but now the pain is back. And another one is nerve gliding exercise. So the patient may benefit from this when the median nerve move more freely within the confine of the carpal tunnel. So there's no hyperflexion and hyperextension. This also helps the patient. It helps their symptom. Okay, another one under this non-surgical treatment is PRP injection. That is platelet-rich plasma injection. You know, I've actually witnessed this, and I've assisted doctors in this procedure. So it's quite okay. It's just this transfusion of patient plasma will separate it and infusing it back into the patient. So this is derived from patient's own blood. The patient blood is taken, and there's a centrifuge, that is, there's a machine, and centrifugation is done just to separate the plasma from the blood, and the plasma is now injected back into the musculoskeletal condition, which is carpal tunnel syndrome, because carpal tunnel syndrome is a musculoskeletal condition. So it's injected back to the sides to also give the patient relief, reduce flaring, and to reduce pain. But it's also not a long-term treatment. It's a short-term treatment. Okay, so let's talk about the surgical treatment. So before the doctor can finally recommend surgery, you want to know the severity of the symptoms. The physical examination, want to really check if the patient is really in need of the surgery, and want to check for the response to non-operative, that is non-surgical treatment. And the last one is the result of the diagnostic tests that I mentioned earlier. So the first one is carpal tunnel release surgery. And how is this done? The main goal in this surgery is a transverse carpal ligament. I want you to take note of that, because the three types of the carpal tunnel surgery that I'll be talking about, they have to do with this transverse carpal ligament. And in this carpal tunnel release surgery, the transverse carpal ligament is cut during the carpal tunnel release surgery. And when the ligament now heals, it creates more room for the nerve and the tendon. Very simple. So when there's a cut, excision of the ligament, so that when the ligament is, creates more room for the tendons and the nerve to function properly. Another one is open carpal tunnel release. And how is it done? It's just creating a small incision in the palm of the hand of the patient, and the doctor will now view the inside of the hand and the wrist through the incision. So the doctor will view the hand and the wrist through the incision, and during the procedure, then the transverse carpal ligament, will be divided. So it will be divided, and it will increase the size of the tunnel and decrease the pressure on the nerve. Very, very simple. So they will divide the transverse carpal ligament just to create room. But it's just incision, just a small hole on the palm of the hand, just to view the hand and the wrist and get through to the transverse carpal ligament, and the space is created. Another one is endoscopic carpal tunnel release. This one is just like the second one I mentioned, which is open carpal tunnel release. But this one is just with the use of endoscope. And another difference between the two is that the surgeon will create more than one incision on the palm of the hand of the patient. So that's just the two difference between the open carpal tunnel release and endoscopic carpal tunnel release, is that there will be use of endoscope, and this one is not only one incision, it will be more than one incision. So the doctor makes one or two incisions on the palm of the hand, now use endoscope to view the hand and the wrist, and still divide the transverse tunnel ligament, just to create room for the effective functioning of the medial nerve. So let's talk about the complication from surgery. Normal complication from surgery. There's no small surgery. No matter how minor the surgery is, there can still be complication. And I know that within in your mind, you are already thinking about some things, which are infection, bleeding, wound healing issue, delayed healing, and nerve aggravation or injury. So this kind of surgery, the three types of surgery that I've mentioned, can create more damage or injury to the nerve. There can be bleeding, there can be infection, and there can be delayed wound healing. So let's talk about the prognosis of this surgery. The prognosis of this surgery is, it can take up to The healing is gradual, and it's for complete recovery. It may take up to a year. It may take up to a year before the patient finally recovers. All right, so we've come to the end of part 1 of carpal tunnel syndrome. So the next time we'll be moving to part 2 of carpal tunnel syndrome, where we talk about other aspects of this particular disease condition. My name is Nurse Felicia. If you have not subscribed to my channel, kindly subscribe. I beg you, subscribe to my channel. And until the next time, bye.